Have you been thinking about lowering your hairline and not sure whether to choose hair grafts or hairline lowering? I'm Dr. Sarah Saxon, double board certified facial plastic surgeon, and I specialize in hairline lowering surgery, also called forehead reduction surgery. So recently I came across Dr. Anthony Youn's video on YouTube. He was talking about Chrissy Teigen's recent hairline lowering procedure and had some strong comments about why people shouldn't do hairline lowering. And so today I want to go through his video and give my opinion based on my personal experience of some of the comments he made. I'll also talk about why I prefer hairline lowering surgery over hair grafts and give some real life examples of patients who have come to me who have had hair grafts in the past, who wanted me to reverse them, cut out those hair grafts, and do hairline lowering instead. So let's get started.
I have never seen a forehead scar like that, and what we call an anterior hairline brow lift, a hairline lowering scar. I've never seen one that I thought looked natural. No.
He may not have seen one that looks natural, but he obviously hasn't seen every hairline lowering procedure. So if used with the right technique, there are several surgeons around the country here that we all use a technique that limits tension on the incision and actually looks very natural. Small hairs grow through the incision, it lightens up. I use several different techniques that I'll discuss after this video to show how I have better scar results than most.
I see. You've got a scar right on the edge of the hairline, and that scar will be visible. But yes, the scar can fade with time, but still it can be visible. And a lot of the patients who get this type of procedure done, they get it because their forehead is receding, their hair is receding.
I never actually do hairline lowering on anyone whose hairline is changing. And actually, the vast majority of people who come to me say their hairline has been the same since they were a little kid. They were self-conscious of it, they were made fun of even as a child. And so their hairline is never really going to change.
And now you have a scar right at the front of the hairline. What happens if it continues to recede? Now you may have literally a scar and then a gap and then where you receded hairline.
This is why I don't do hairline lowering in men typically, especially if they are having changes in their hairline with testosterone. They are more likely for this to happen, and I do recommend hair grafts in men more times than not.
So I am not a fan of these types of operations because it may look okay now, but when you wear the hair up, people may see that scar. And the other thing is that as you get older, you may find that hairline moves back even further, and now you got this big scar up there that you can't really hide. So I know what you may be saying. You're saying, Dr. Youn, you're not giving an option for somebody who then has this issue and they want to do something about it. The good news is there is an option, and that option to me makes so much more sense, and I'm not sure why they don't do this on everybody. And maybe with Chrissy they did, it didn't work for her, but essentially what I like better is instead of surgically removing your forehead skin, why not just do hair transplants to create a new hairline? And you can recreate the hairline with hair transplants. It's done all the time. That is not going to create a...
It is done all the time, but it doesn't mean it necessarily looks more natural than hairline lowering. I see patients on a weekly basis that have to hide their hairline all the time because they opted for hair grafts. And it's because the hair that you will put in the hairline is not the same thickness or density than the hair that's naturally at the hairline. And also it's hard to get the right thickness of hair by recreating the whole hairline with hair grafts.
Visible scar. And if those hair transplants recede, which is much less likely because they're hair transplants, they don't act like the hair at the front of the hairline, that seems to make a lot more sense than giving a person a long scar like that.
Now, I'm not a fan of saying absolutely this one procedure is bad and this one is good, because there's always nuance in different procedures. There are some hair graft surgeons in this country that do a great job and they know where to harvest hair from to get a nice result. But for the most part, the people that come to me who've had hair grafts have a lot of anxiety and a lot of unsatisfaction with their result. And this is because whoever they went for hair grafts, they could have gone to someone just because it was a little bit cheaper. They took hair from behind the hair here. That hair's thicker. And so You have little tiny micro hairs right at the front of your hairline. If you put a thick hair graft in the front of the hairline, that's going to look very obvious, almost a doll's hair. And some people use single follicular units, some people use individual hairs, but where they take the hair from makes a big difference. And getting the right density of hair is very difficult when you're grafting hair in an area that's never had hair before. It usually takes several different rounds of hair grafts, and even then, it's very difficult to get the same density as the hair behind where the hair grafts are. So, what I tend to end up doing, and I'll show an example of a recent patient that I had to actually go in at her natural hairline, cut out all those hair grafts, and basically do what I would have done in the first place to do hairline lowering. When I recommend hair grafts, it's usually just to touch up little areas like on the sides of the hair. If someone has a lot of temporal recession, I may not always be able to round off the hairline exactly how I want it to be, but you can put a couple little hair grafts just to camouflage everything. Sometimes I've seen also hair graft surgeons will almost overarch the hairline overly aggressively, and it looks unnatural as well. The hairline is not very uniform. It is zigzaggy, just jagged, what I call irregularly irregular. If you make a very crisp edge to where the hair is versus where it's not, it's going to be very obvious. And so, for that reason, hairline lowering just tends to look more natural. Certainly, there are skilled hair graft surgeons and those that aren't as skilled. There's also more skilled hairline lowering surgeons and less skilled. So, if someone is not doing a lot of hairline lowering, they may not use the same techniques as someone who is doing a lot of it and have fine tuned their technique over time to get the best results. Now, what I do to maximize the healing and make the incision look as natural as possible with as little scarring as possible is I release several key areas that take tension off the incision and allow me to rotate the scalp a lot more forward. I have a separate whole video about this, but to be brief, I release all the way back to allow the whole scalp to rotate forward, and including the coronal suture line as well as the temporal line. I also have a specific technique in goniotomies that allow the scalp to stretch a lot more. All these things take more tension off the incision. I also place sutures in the galea or the strength layer of the scalp, and those stitches stay in about 3 months before your body resorbs them. So that takes tension off. And the last thing I do that I think is key is use platelet-rich fibrin at the time of surgery, and that has been a game changer in how the incision looks, both in the short term and the long term. Now, aftercare is very important too. So I have all my patients use a hypochlorous acid spray to reduce inflammation. I don't have anyone use ointments because it just gets stuck in all the hair and is almost impossible to clean. But it also, I think, harbors a lot of bacteria and inflammation. So the incision is generally more red than I typically see if I'm just using hypochlorous acid. Even at the 1 month mark, I do start to see hairs grow through the incision, but certainly between that 3 and 6 month mark, most people are so happy with their results that they no longer have to cover up their hairline, not even putting on makeup for the incision because the pink has faded away. They might still have a little numbness that takes about a year to resolve, but by and large, my patients are so happy when they've gotten all their hair grafts taken out and done hairline lowering as a replacement that they're regretful that they spent all the money on hair grafts to start with. They think they're going to save money and time by doing hair grafts, but in fact, it's quite the opposite. So I don't want anyone to have regrets when it comes to making their forehead smaller. And so what I recommend is starting with hairline lowering. And even if you need 2 stages or a few hair grafts just to fine tune things, that's a better option in my opinion versus just doing hair grafts in the first place. I do think Dr. Youn is a good surgeon and he has his best intentions, but he obviously doesn't see a lot of patients for this particular problem. and is speculating on what he thinks would be a good idea versus not. So I hope this video helps you. I want you to get the best result you can. And so if you have any questions, definitely leave a comment below. I'd be happy to answer anything. And don't hesitate to contact us to schedule a consultation. Again, I'm Dr. Sarah Saxon. I'm in Austin and Dallas, Texas. Don't forget to like and subscribe this video for more helpful information.